Hi, I'm Dr. Kamal Woods, a neurosurgeon here at Vertrae Surgery Center. I want to talk with you today about a type of neuromodulation that, honestly, a lot of chronic pain patients have just never heard of. And for a very specific kind of pain, it might be the single most important tool we have.
Does this sound at all familiar? This is the reality for so many people I see. We're talking about a pain that just completely reorganizes your life, where simple things, putting on a sock, the feeling of a cool breeze, become absolutely unbearable. It's a very specific kind of pain, and it really deserves a very specific conversation.
So let's just be direct about who this explainer is really for. My goal here is to help you see if your own experience lines up with the condition this therapy was specifically designed to treat.
We're talking about complex regional pain syndrome, or CRPS. We're talking about that nagging nerve pain that just stuck around long after something like a hernia repair or knee replacement was supposed to have healed completely. And we're talking about pain that's in one specific nerve territory, a foot, a hand, maybe one side of the groin. If you've been diagnosed with one of these, you are absolutely in the right place.
You've probably been through the gauntlet, right? You've tried medications, injections, different therapies, and nothing has provided real, lasting relief. Well, there's a very good reason for that. It's because most of those treatments, they aren't designed to reach the specific structure that's actually generating the pain signals. So, what is that structure?
The answer, more often than not, lies in a part of your nervous system that you've probably never even heard mentioned in a doctor's appointment. It's called the dorsal root ganglion, or the DRG for short. And it is, very often, the hidden source of the entire problem.
Okay, so what is it? Think of the DRG as a tiny little command center, or a gatekeeper, for a single nerve. Before any sensory signal, whether it's touch, temperature, or pain, can even get to your spinal cord and then up to your brain, it has to pass through this ganglion. Each DRG is responsible for one specific little patch of your body.
And here is the absolute core of the problem. After an injury or a surgery, this little command center can get stuck on high alert. It becomes what we call hyperexcitable. It's basically acting like a faulty fire alarm, just blasting pain signals for no reason, or in response to something as light as a bedsheet brushing against your skin. And this is why your MRIs, your other tests, they often come back totally normal. They aren't looking at the cellular level, which is where the problem actually lives.
So you can see where this is going, right? If the problem is a single specific overactive DRG, then the solution needs to be just as specific. And that solution is DRG stimulation, a therapy designed to target that one structure directly.
Now, to really get the difference here, think of it this way. Conventional spinal cord stimulation, or SCS, is kind of like a floodlight. It casts a wide light over a broad area of the spinal cord, and that can be great for widespread pain. DRG stimulation, on the other hand, is like a laser pointer. It targets only the single, malfunctioning DRG that's responsible for your very specific area of pain, and it leaves the other areas alone. It's all about precision.
Okay, so it sounds great in theory, but does this precision actually lead to better results for patients? For that, we've got to look at the evidence. And the landmark clinical trial that really established this therapy is called the ACCURATE trial.
When the results of this trial came out, it was a truly pivotal moment in pain management. For patients with CRPS, which is a condition that is notoriously difficult to treat, the outcomes for DRG stimulation, they weren't just a small step forward. They represented a complete and total shift in what we thought was even possible.
And here are the numbers, because they really tell the story. The trial defined success as getting at least 50% pain relief. After just 3 months, over 81% of the patients who got DRG stimulation hit that mark. Now compare that to just under 56% for conventional SCS. For someone living with this kind of debilitating pain, the difference between a 56% chance and an 81% chance of major relief, well, that's just life-changing.
But the next big question is always, did it last? And the answer is yes, absolutely. 1 year later, almost 3/4 of the DRG stimulation patients were still getting that same level of profound pain relief. So this wasn't some temporary fix, this was durable, sustained success.
And this leads to maybe the most crucial point of all. The therapy didn't wear out. With some kinds of neurostimulation, the body can kind of get used to it over time, and it just becomes less effective. The ACCURATE trial actually found this happened with the SCS group, but it did not happen with DRG stimulation. The relief at 1 month was the same as the relief at 1 year.
Now, the evidence is incredibly compelling, but DRG stimulation is not a magic bullet for all pain. A precision tool is only effective when you use it for the right job. So let's have an honest conversation about who this is really for.
This therapy is designed from the ground up for focal pain. The absolute best candidates are people who can literally point to their pain. They can trace its exact boundaries with their finger. If your pain lives in one specific spot, like your foot after an old injury or one side of your groin after a hernia surgery, that is a huge indicator that DRG-SRS might be the right approach for you.
And it is just as important to say who this is not for. If your pain is widespread, all over, or if it's primarily low back pain that just stays in your back, DRG-S is not the first-line choice. There are other tools, like some of the more advanced forms of SCS, that have much stronger evidence for those pain patterns. The whole goal here is to match the right patient to the right therapy. So if you're watching this and you're thinking, wow, this really sounds like me, what happens next? Well, the path forward is actually very clear, and it's designed to give you total confidence in the decision you make.
It's a two-stage process. First, and most importantly, you do a trial. We place temporary leads and you go home with a small external device for about a week. You just live your life and you see for yourself if this gives you the relief you need. It's essentially a try before you buy system. And only if that trial is a clear success do we even consider proceeding with implanting the small, permanent device.
You know, when you come to Vertrae for an evaluation, it is never a sales pitch for a procedure. It's a clinical conversation. We sit down, we review your history, we talk about your symptoms, your goals, and we figure out together if this is truly the right tool for your specific pain, or if maybe another direction makes more sense.
So I'll just leave you with this question. If you have been living with a persistent focal pain that other treatments just haven't been able to touch, could it be that you just haven't had access to the right tool for the job? A more precise tool, aimed directly at the hidden source of your pain, really might be the answer you've been looking for.